I'm not quite sure if the industry is aware of how disruptive Fastbraces technology is compared to traditional braces or clear aligners, but I just know my patients are very, very happy about it, specifically because of time, and for us as economics, it's through the roof. Everyone's just really, really excited about it. As a general practitioner, it's easier for us to use a single wire than traditional braces, which is multitude of wires. I think ultimately, within 100 days, to see actual results not only surprises the patients, but it's easier on me for chair time and for patients as far as soreness or any sort of discomfort for them.
The alveolar bone formulation does indeed allow one to predict the duration of time within days. So there's an initial skepticism when a patient comes in and you tell them, after you've performed your measurements, etc., and calculated it on the alveolar bone formula, I'm going to treat your malalignment within X number of days. So immediately they are skeptical because they know relatives and friends whose duration of treatment with the conventional orthodontic systems were in years, measured in years. However, this skepticism soon changes to enthusiasm when you show them before and after photographs of cases completed with Fastbraces. And that enthusiasm then changes to when can we start treatment?
Fastbraces has developed an alveolar bone formula score which helps us calculate the treatment time for patients in days. This is because we are concentrating on and focusing on treating the deficiency or the amount of alveolar bone in the patient's mouth, which we term orthodontosis. We're not using the conventional approach of thinking about crowded or spaced teeth. And so when we do this and we treat the alveolar bone, the teeth just follow, and the natural result then is a beautiful smile. We measure treatment time with Fastbraces in days because that's how quickly we can get results when we concentrate on treating the alveolar bone and think about moving the apex of the roots of the teeth in the first instance. I've done many hundreds of cases since 2011, and the average treatment time for my cases is 120 to 150 days.
One of the reasons why we brought in Fastbraces is also because most of our patients are adult patients. And adult patients don't want to wear braces for 1, 2, 3, 4, 5 years. As professional, nobody wants to walk around with brackets for years. So what Fastbraces allow us to do is to treat the patient efficiently, safely, and within 100 days to even 200 days. So we're talking about 3 to 6 months to even 8 months in the most difficult case. So we use the alveolar bone formula to calculate the severity of the malformation of the bone. Just like blood pressure, you have to know how high the blood pressure is before you can correctly treat the patient, how much dosage. So with the bone formula score, I can determine if I can treat the patient in 50 days, 100 days, 200 days. So that helps us to more accurately finish our patient in a timely manner.
We're looking at the dentition in a different way, in a completely different way. We just look at the cupping, looking at how deep the tooth is in the arch, and just use that as a determinant to figure out how long it's going to take to finish the case. Again, it was very exciting.
So the diagnosis based on cupping depth helps the practitioner envision what the treatment difficulty will be like. It used to be that we learned in dental schools, class 1, 2, and 3 divisions, mild, moderate, and severe crowding, but thinking about teeth in that manner is very limiting and does not give you the true indication of how difficult or how achievable the results will be, versus with the cupping depth, it gives you a better idea of being able to predict treatments.
So the cupping depth diagnosis is a game changer too for Fastbraces. Whereas before, we would look at these things as impossible to do, needing surgery or complicating things. Looking at it now from the lens, again, Fastbraces, you have to delete everything you knew about braces before, and everything you knew about orthodontics and how to move teeth. It is makes it faster, actually makes it as an opportunity to grow the bone. You almost get happy when you see it once you get used to how to treat again. So you see it as now an advantage and a tool that you can use to grow the bone and grow the mouth in ways that we were told were impossible to do before.
We're looking more at the bone shape, the bone morphology, and placing brackets on individualized teeth and not all at once allows for us to use the biology, the biochemistry in the bone, and to move teeth.
With the new technology developed by the founder of Fastbraces, it allows us to incorporate cupping depth into our treatment. It would take dentistry and ortho to straighten teeth to the next level, in my opinion.
Cupping depth provides a whole different way of looking at it, looking at the bony defect and the ability to grow bone in a horizontal format, which is something that we've never been able to do before. That one thing alone has dramatically impacted the way we look at orthodontic cases, where we don't have to extract teeth.
With the Fastbraces technology, we're able to measure time not in years or months, but in days. I like Fastbraces as compared to maybe aligners or some of the other techniques because of the predictability. We're able to grow bone, and we don't just tip teeth, we're actually moving teeth, and that makes a big difference. The Fastbraces system, like I said, it's predictable, and we're able to get cases closed in a predictable time. That turns into dollars for patients. The longer they're in them, there's a cost for everybody, but if we can reduce that time, it does save them time, and it saves them money.
Fastbraces is so fast. We can predict how long the treatment can be finished. The system of Fastbraces is very good because they can control the root movement. Okay, the root bodily movement and crown also, and we use only one wire for all the way. I think Fastbraces is the future braces. I use many braces. I use a liner, but I'm very satisfied with the result of Fastbraces.